When?
Right now, yeah.
Yeah, when,
A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it. Excuse me. A lot of doctors take it. I take it.
So what do you think, Sanjay?
Well, he shouldn't be taking it. I mean, you know, his own FDA has said that this is still something under investigation. It should not be taken outside of a clinical trial. Taken out of only hospitalized patients should be getting it. I mean, what he said about the fact that it's been used for malaria prophylaxis for decades is true. What we have found more recently is in people who already have COVID, already have this disease, that there are some real concerns, you know, and concerns about impact on the heart, possibly causing these heart arrhythmias, things like that. He said that there's a lot of healthcare workers that are taking it. I mean, there is a trial that is going on still. Most of the data that we've been talking about, Wolf, which was not at all impressive regarding hydroxychloroquine, was in people who already had the disease or already quite sick. There has been this lingering question, could it be used more as a prophylaxis to prevent the virus from entering cells in the first place? There's no evidence to suggest that, but as we have tried to be very responsible, you know, we want to present the evidence as we get it. There's no evidence to say that that works in that way. That trial is ongoing. It's for healthcare workers who have significant exposures. And obviously, President Trump doesn't fit either of those categories. So, you know, this is one of those things that I think is going to cause a lot of confusion in people. But according to his own FDA, they say that this should not be used outside of a clinical trial or for patients already in the hospital. I don't know who prescribed this for him. It is a prescription drug. I hope, given that he has a history of heart disease, that he is being monitored in some way so he doesn't develop a problem. I'm not suggesting that he would as a prophylaxis drug, but you know, he obviously has to be careful.
A clear message I want to make sure everyone in the public hears is that there is no evidence that tells us that taking hydroxychloroquine is either safe or effective for preventing COVID-19 infection. As leaders, it's essential that we lead by example. It's true for public officials in particular when the spotlight is on them. And this risks sending the wrong message to people, and that could come at a serious cost to them.